Hi guys, this is Dr. Mick. Hope you're doing well still. So in this video, we're going to be talking about the reproductive and urinary tracts of the female cat. So we're going to start with the reproductive tract and then we'll move on to the urinary tract. So the first structure we're going to look for is going to be the ovary, which is going to hold the unfertilized eggs. Now this is pretty far along against the body wall, so you're going to want to move all of your intestines out of the way. Now the ovary is very close to the oviduct, so it's going to be, it may look like they're the same structure when in reality they're not. So this specific bean-shaped region that my probe is on is the ovary. The surrounding tissue to that, such as here that I'm flapping with my probe, is the oviduct. I'm going to show you on the other side as well, but just to know that those structures are very close together and it can be easy to get them confused. So when I go to the other side, push this big old spleen out of the way. When I turn this dilated structure over, oops, doesn't want me to hold it. This specific raised bean-shaped area is the ovary. Now, then we're going to move into the oviduct, and the opening of that right here is kind of a funnel-shaped region, and that's the area that the egg is going to travel into to enter the oviduct. When I turn that structure over, you'll see the remainder of the oviduct here. Now the ovary is held to the body wall by the mesovarium. So that's going to be that saran wrap like structure that you'll probably remember from the shark. And then we have the mesosalpinx, which is supporting the oviduct. So that's going to be, on the other side, essentially. Then after the oviduct, we're going to see the end of the oviduct right here. And the fertilized egg would be entering into the uterine horn. I'm going to flip this back over so you get a better view. The uterine horn. And these guys have two uterine horns, so we have one on this side. If we look at the other side, it's along here is our uterine horn. And they have these uterine horns because they have litters. So they have many babies, and we need spots for those many embryos to grow and develop. Unlike us, where we just have one main component to the uterus, these guys need to have all that extra room for their 6 or 8 kittens that they're going to have. Now, the uterus is supported by its own saran wrap-like connective structure here called the mesometrium, and that's going to support the uterine horns. Now, the uterine horns do come to form at the base, the body of the uterus. So that's a very small area because, again, they're really only developing in the uterine horns, and then as they're born, they're going to get pushed towards this uterine body. When they end up leaving that region, they're going to pass through the vagina, which we'll see the external opening to that here. In females, the vagina is a slit-like structure. As opposed to males, which you'll learn about, have more of a hole. The females have a slit, and that's the opening to the vagina where the young will be birthed through. One other external structure we've had you know before as well, here's the anus, and that's going to be dorsal to the vagina. So here's the anus, and that's where the stool is going to be passed through after it goes through the large intestine. And here we have the vagina. So that should cover everything for our reproductive tract. So now we're going to go into the urinary tract. We're going to start with our kidneys. So kidneys lie against the body wall as well. So here's one kidney. Let me move our posterior liver lobe out of the way. Here's our kidney. We have one on the other side as well. The kidneys are often surrounded by fat, so especially in adult animals like this one, in order to get a better view, we'll have to peel away some of that fat. Now, this term is not in your lab manual, I don't believe, but we do have you know it, and that is this membrane that's covering the kidney. I'm going to get a different tool so I can kind of lift that a little bit. So here, it's this membrane covering the kidney, and this is called the renal capsule. So this is helping to protect the kidney. Now, I peeled away some of the fat along this kidney, and after the kidneys are filtering the blood, they're going to be passing then urine into the ureters. So the ureters, there's one on each side, but we can just see it better in this side. I'm gonna switch back to my probe. You're gonna see that leaving the kidney, and it's going to be a tube that we're gonna see coming all the way down. So we can still see we have it here. And that is, comes down a little further and then dumps the urine into the urinary bladder. Again, we want to call it a urinary bladder to differentiate it from a gallbladder. We don't want to call it just a bladder, but this is where urine is going to be stored. It would inflate if it were full, but this kitty's bladder is empty. And then we can't see it just based on the pelvis of the cat, but after urine goes through the urinary bladder, it's going to go into the urethra and then be urinated out through the urethra of the cat. We do want to get a closer look at the kidney itself, so we're going to dissect that out. So I'm going to take scissors here for it. You can use whatever tool you feel most comfortable with. But I just kind of want to get this kidney out of this guy. Well, this gal, I should say. We will have to snip the ureter in order to do that, which is fine. And I'm just going to dig around a little in this kitty to dissect this structure out. Because we have a couple more terms we're going to want you to know. While I'm doing this, a fun fact that includes removing kidneys in cats is that PenVet actually does kidney transplants in cats. So for cats who have acute kidney injuries, they will take out a kidney from a healthy shelter cat and put it into a cat who's in kidney failure. And what's cool about their program is that the shelter cats are then adopted out to the same family that the recipient is from. So it's kind of cool. So now that we have our kidney out, and you can see here's where the stump of our ureter is. Other things that would be going into the kidney that you should be familiar with are the renal artery and renal vein. In terms of this structure, this indentation here where those vessels are coming in, that's going to be called our hilus of the kidney. And then we're actually going to want to cut into the kidney itself. So I'm going to kind of snip away this renal capsule first. The kidneys are my favorite organ. I think they're responsible for such important things in the body. So we're also peeling away some of that fat that's on this guy. When you're doing this, you may want to use scissors that are a little thinner. These are a little bit chunky for what we need here, but it'll still help us accomplish our purpose. All right. They're such a cute little organ. So again, here we have our hilus of the kidney, is this little indented region where all the vessels are coming in. And then to show you the inside of the kidney, I'm actually going to grab a scalpel. So Dr. Mason is wearing two hats right now as cameraman and supplier of the scalpel. And And when we cut, we want to do a sagittal cut, which I know you guys are familiar with by now. So we can go as close to midline as we can. And we're just going to want to cut down the middle and see what we can see. Now this cat's not dyed, so it'll look even prettier in an animal where it was dyed. But if we look into the area that would be the hilus of the kidney on the outside where those vessels are coming in, on the inside we call that the renal sinus. So on each side, here's the renal sinus. And then the two parts of the kidney that we want you to know on the inside, we have the outer cortex, so the cortex, and the inner portion is the medulla. So here's the medulla. And that's what we want you guys to know for the urinary system for these guys. All right, so we'll see you in the next video. Hi guys, this is Dr. Mick, and we're here with the male cat. Most of our specimens this year were female, so we have a kitten here as our male. We're going to be talking a quick review of the urinary system and then discussing the reproductive system. So as our quick review of the urinary system, we have our kidney over here. I'm not going to take the kidney out on this one. That way the group who has this kitten will have the pleasure of doing that. But there's a lot less fat around this kidney because this is a kitten. So we are able to much more easily see our ureter, which is coming out of the kidney carrying urine and dumping into the urinary bladder. This will then go into the urethra, which we can't see due to the pelvis being in the way, and then will come out through the penis. And we'll look at that a little bit later. So we're now going to go into our urogenital system. And the first term that we want you to know, which I don't believe is a term in your figure, but it's called the scrotum. And the scrotum is the sac, essentially, that's covering the testes. So it's, covered with fur right surrounding the area where the testes are. So the scrotum in this cat is here. It will be more obvious in adult cats just because their testes are bigger, so it'll look like a bigger bulge in that region. When we cut into the scrotum to locate the testes, which I did on this side, I cut into the scrotum and we have our testy right here. So right where my probe is, it's a tiny bean about this area in size. This is covered by connective tissue, as you can see further up, that there's a band of connective tissue. I snipped away at that connective tissue to expose our testy. There's still a little bit of connective tissue that I couldn't nicely remove on the end here. But I wanted you to be able to see the testy. And then after, sperm are made in the testes, they go to the epididymis for storage and maturing. And the epididymis has 3 different parts to it. So the area, it's a very thin tube, and the area closest to the most cranial part of the testes, so it's right, this thin tube along the side. Hopefully the camera is able to pick that up. So we first have the head of the epididymis. Going along the side of the testy, it turns into the body of the epididymis. And then at the end, so the most caudal portion, so right here, my forceps is holding connective tissue, but my probe is pointing at the tail of the epididymis. Again, in an adult animal, this would be a lot easier to see. This then is going to travel up the spermatic cord, so the area where the fascia is still covering, but that goes into the ductus deferens, which I'll show you from inside the cat. So the ductus deferens we can see as a loop here. So it came up through the spermatic cord. I have my probe underneath of it. and then it's going to be going into the urethra, which again, we can't see due to the pelvis. But here it is on this side, and if I turn our bladder a little bit, I can see our ductus deferens on this side as well, right here. The other terms that we do want you to know are two glands that we're also not going to be able to see. Just like the urethra, we can't see the prostate gland, but we do want you to know the function, as well as the bulbourethral gland. And then the urethra ends up turning and terminating its secretions through the penis. Now, when we're looking at this cat, we can see that instead of, I did cut here, but if I did not cut this piece of tissue, we would see that there's a little hole right there. So instead of that longer slit that we had in the female, it was just a tiny hole in him. And that's indicating he's a male. So when we cut away at that outer covering of tissue, and I just opened it up, I did a small cut here, we can see that the penis is right under my probe here. And I'll see if I can show you from, kind of expose it a little more. But the penis is right there. And then that's where the urinary and the reproductive fluids are going to be expelled from. And that should be all for our male reproductive system. So stay on top of everything with all the information, read your lab manual, and it's been so wonderful working with you guys this year.